Today's topic is one of the most powerful medicinal plants in the world. The marijuana plant has been used all over the world for thousands of years. We're going to talk about this in our live session today in the Q&A at the end, and whether it is the cause or the cure to anxiety. It is the third most used substance in the world after alcohol and tobacco. And it is so widely used in the United States that about 1 in 4 12th graders have used marijuana in the last month. And across all United States adults, it's about 17%, really attesting to how entrenched it is, given its 5,000 plus year history. So the medicinal uses of this plant are very common. In fact, they are so powerful that pharmaceuticals have synthesized synthetic cannabinoids, meaning they've actually tried to reduce the parts of the marijuana or cannabis plant that have more direct acting medicinal use. And these can range anywhere from anxiety to anti-epileptics or helping with seizures for weight gain, in particular, patients like HIV, weight loss. Anxiety and chronic pain are some of the other and most commonly used applications in marijuana. Prescription medications that I use every day as both a Western and holistic doctor have a lot of problems. I use them every day, but let's not forget that most big pharma push medications are often band-aids. They're not addressing the root causes of any complications, and they don't have favorable economics. They're expensive. They have side effects. Did you know that 1% of all emergency room visits might in fact be due to medication side effects, prescription medication side effects? Prescription medications are far from safe. But the problem is that modern day cannabis that you buy at the dispensary, especially here in San Francisco where I practice, isn't so benign. So it is so potent nowadays with THC concentrations above 20 to 30%. That's not to mention hash oil that could be 80 to 90%. That the paradoxical side effects from cannabis are also potentially very high. This is not the, grandparents' cannabis of decades past where it was 2 to 3%. So whether patients are coming to me in the hospital because of vomiting or nausea or intense paranoia or extreme lethargy or sedation because they took one too many, because they took 1 or 2 little legs off of the gummy or the brownie that they were supposed to only have one little piece of. These side effects are real, and they can account for a large number of emergency room visits as well. Not too different compared to prescription medications. I'll give you the numbers in a second. But what most patients don't know is that individuals that are using marijuana on a daily basis, it actually shows in their bodies when they're here in the operating room, like where I am right now, on the table. They need significantly higher doses of anesthesia, especially the liquid anesthesia or propofol. To a certain extent, the stuff that comes out of the ventilator behind me as well. Without dropping the camera, let's put this back down. So the more potent this cannabis, it's almost become like a medication in and of itself. And whether it can cause or cure anxiety, well, you can't leave anxiety undertreated because it can have serious physical side effects and physical problems. The psychological and physical bodies are inseparable. You can't treat one ailment without addressing the other constituents. So, for example, undertreated anxiety can predispose absolutely to heart disease, that broken heart syndrome, loneliness itself, which can cause so many complications on par with smoking multiple cigarettes a day. So we can't ignore anxiety. Your mental health clearly matters, but we can't ignore the side effects from the medications that we're using to treat it. So cannabis leads a sizable number of patients to the emergency room every year. In fact, the study that is so interesting that came out very recently was done in Canada, which looked at patients who were admitted to the emergency department for cannabis-related reasons, had a 23.6% chance of moving on in life to have an anxiety-related hospitalization, outpatient visit, or another emergency room visit, but this time due to anxiety, compared to 5.6% of the others. This study had 12 million emergency room visits that it looked at, and 35,000 of those were for cannabis. So that's a lot of numbers. It's a lot of data. This is not causal data, but it is an association. Remember, I'm not anti-marijuana. I'm not anti-Western medicine, but you need to use them judiciously in the right patient, in the right context. And we cannot overblow the beneficial effects or understate the side effects. Unfortunately, younger men are the patients at the highest risk in this study of going on from presenting to the emergency department for a cannabis-related reason and then going on to developing an anxiety disorder requiring pretty intensive follow-up, medical-grade intervention. I'm not saying anxiety is bad. I'm not stigmatizing anxiety, but is marijuana a harbinger of future anxiety is a very, very important question, given how much it is being pushed in society, especially among young individuals. Like we said, high schoolers, 1 in 4 of them using it. So what explains this paradox? Isn't cannabis supposed to help with anxiety? Isn't that why most individuals use it, or else for chronic pain or for nausea? Well, there is a huge paradox in all the medications and plants out there. Look at caffeine. Caffeine comes from a natural source after all, right? Tea or coffee. I'm not saying tea or coffee are bad, but it is undeniable that caffeine can have significantly different effects in some individuals compared to others. You know people that can drink a pot of coffee at night and fall asleep just fine. And you probably know some that can have a cup in the morning and will have trouble sleeping that night. Or whether it's migraines or whether it's palpitations, there is so much variation that it's almost difficult to study this because some individuals respond so differently and we don't yet know the genetic causes for this. This is from a natural occurring substance, caffeine. Don't even talk about the chemically synthesized medications, benzodiazepines. How many of my patients have that paradoxical agitation to which would otherwise be a sedating medication? You can imagine this can lead to a lot of gaslighting when a patient tries to explain their paradoxical effect to a medication that is known to have the exact opposite effect. It does not bode well, and I hope that you feel empowered to speak up for yourself if you're one of those people. I mentioned SSRIs on here. SSRIs are supposed to help with depression, but in some individuals, especially those who are younger, there is a black box warning that it can actually increase suicidal thoughts, thoughts of self-harm, completely the opposite of what you're trying to do with it. And then, of course, ketamine, near and dear to my heart, because you know that I run a holistic ketamine infusion center, but ketamine can be so healing for so many individuals, but if not used in the right setting, can lead to what's called a bad trip and can have the opposite effect. So paradoxes are not new, and it's not just marijuana, but marijuana is used on such a wide scale. And it's often not with that level of education for patients and individuals. All you have to do is follow the money. This market, you know, everyone says big pharma is huge, and it is. But marijuana is projected to grow from 57 billion to 444 billion by the end of the decade. Well, you got to follow the money trail, not only for big pharma, but also other natural supplements and medicinals as well. Once again, I'm not anti-Western medicine, nor am I anti-marijuana, but you can't ignore the hard facts and the realities. So more about the other plant medicines that fall into this, but if you're learning something new, please hit that like button, share what you learned with others, with your loved ones, help advocate better for your health in this broken healthcare system. And if you are learning something and you want to engage more with me, you can always join our private Zoom streams that happen every month, twice a month, by clicking the link below. And this graph here on the right now, this actually shows that emergency room data from Canada. If you look at that red line, this is pretty stark. That shows the risk of patients going on to develop a anxiety disorder that they need to go to the hospital or the emergency room for, or an outpatient clinic. That's the red one. Over time on the x-axis, it creeps up slowly. But the blue line, those are for the patients that came with cannabis-related diagnoses. Look how different the blue and the red line are. Now, individual numbers are important, but you just look at that difference, there might well be a signal there. And given the money behind this, well, there might well be a real signal and a real potential ulterior motive to not emphasize these serious risks. Now, remember, it's not just marijuana. For how many decades did we say that tobacco is a natural occurring plant? Was that not safe? What about Purdue Pharmaceuticals? I mean, opium comes from the unripe poppy seed. It's natural, right? And, fast forward a couple decades and here we are in the opioid epidemic. So this is not just marijuana. Anywhere there can be money made off of people's suffering, there will be a push to do it. So you got to recognize the medical reality. There are no long-term miracle drugs, with the exception of possibly one that I'll share. And for those of you who are on life-saving medications, insulin, organ transplant rejection, immunosuppressants, anticoagulants. Guys, I'm not saying that there are not miraculous drugs out there, but they all have side effects. None of them are miracles in the sense that they are all benefit and no risk. Everything in medicine, and you know this, is a benefit to risk ratio. In fact, tell me below, and we'll address as many comments as I can in just a minute here. You know about this, right? Everything in medicine is risk benefit, risk benefit. So what is the one exception, the one potentially miraculous medicinal cure out there? I'm going to actually do a shout out to whoever gets that right. I want to know who. You tell me, I'll give you a shout out. By the way, Rachel, your question about smoking pot before surgery, you should stop. You should stop for many reasons I've talked about in other videos. Roy Quitter says ketamine. No, ketamine has side effects. As much as I appreciate and I advocate for it, it's not a miracle. Exercise, we're getting closer, Ethan. Tropical Bliss says food. You're on the right track. Placebo, says Sanriendo. Some placebos have side effects as well, but you're getting even closer. Tammy O says the brain. Oh, I should have flipped these. We talked about placebo, exercise, food, ketamine, and Tammy O says our brain. So your innate healing capacity is totally underrated because no one can really make money off of it in modern medicine, but has virtually no side effects. But we don't talk about that with our patients. But now you know to advocate for yourself because you have more power over your health than you've probably ever been told. So what I want you to come away with before we launch into the Q&A is that please don't let yourself or your loved ones or your friends be brainwashed. We don't accept direct-to-consumer advertising for pharmaceuticals. Oh, wait, we actually do in the United States and in New Zealand. Well, in the majority of the world, we don't allow direct-to-consumer advertising by pharmaceuticals. Because after all, patients can't go into the store and buy pharmaceuticals. They have to be prescribed by a doctor. Yet we're so okay in the United States doing this. Okay, well, that's its own issue, which many people disagree with. But for these potent chemicals that can affect especially young developing minds like marijuana, kratom, tobacco. Once again, there's a time and a place for some, not all of these. But how are we so okay with just pushing narratives for these powerful medicinals? Yet we're not okay with the prescription big pharma doing it. I'm not saying either one of them is right or wrong, but I want you to think so you can advocate for yourself. And remember who pays in the end. And, well, it's you, because whether it's big pharma spending hundreds of millions of dollars a year in the United States to market their drugs, the consumer is paying the marketing cost. Who's paying the cost when children are taught that marijuana is virtually free of side effects because it's naturally occurring? Once again, forget tobacco, forget opioids, forget everything else out there. Well, it's you who suffers as well. But I want you to not be that person. I want you to advocate for yourself because you have more power over your health than you've ever been told. So if you've learned something, please hit that like button, share what you've learned with others. And let's go on to your comments. Kathy Poland, I am so happy to hear that you are inspired to get off of benzos and gummies. I'm wishing you the best in that. Please don't lose hope. I hope that you have the right support around you to help you in that endeavor. Todd, too bad we didn't allow OTC low dose stations. I think you meant statins instead. Well, there is an OTC statin. Did you know that? Tell me in the comments, what is the OTC statin? And I'll give you a big shout out because there is one. It's the naturally occurring statin out there. Is CBD good for diabetes? Cynthia, good question. Not when we're trying, put it this way, if someone has diabetes, we want to use medications to lower the glucose level because you can have serious microvascular and macrovascular complications. We're talking about pre-diabetes where we don't need that strict reduction. It's a whole different story, but there are so many safer, more empowering ways with mindset and lifestyle to address that. But I got to answer this. Ooh, we got the right answer. Who was the first person who said red yeast rice? Anita Beatty Abers. Did I say that right? Beatty Abers. Yes, red yeast rice has lovastatin in it, which is a naturally occurring statin. It is OTC, but it does have a risk of liver toxicity. So if one needs statins, you should probably go for ones that, well, discuss with your doctor. I'm not going to go there. And Tropical Bliss got it correct as right. Straight talk, no messing. Some drugs sound great. I feel I'll just stick with what's safe and keep exercising and eating right. Awesome. Love back to you, and you're right. Love can be powerful for healing, whether from high cholesterol, like the statin case, or really from any other number of physical or psychological conditions. Okay, this is a long one. Reptiles in the foothills. Adding to consumption sativa versus indica. Said to drink a glass of red wine and smoke weed. I'd rather vape, some live resin. Wow, well, I don't know what doctor this Sebastian guy is here, but, not a doctor, they're from Skid Row. Okay, never mind. Not. Medical advice not recommended. Oreos do not work better than statins, free cap. That's a good joke. I saw this title and have to say that illegal cannabis causes anxiety. Making it legal cured my anxiety. Well, this is a big question about what kinds of formulations of cannabis are allowed. Well, big question there. Berberine, I think that's what you mean instead of Bedburin, Karen Brown Barrios. It certainly has some benefits in diabetics. Its effects on blood glucose are very small compared to prescription medications. The side effect profile is typically smaller as well. It's a personalized decision that you need to have with your doctor. In terms of losing weight, berberine is nothing close to semaglutide or Ozempic, though. And yes, olive oil is fantastic, Rhonda, part of the Mediterranean diet. LOL, right back to you, Sean. Spelled S-H-U-N. Tammy, thank you so much for the kind comments. And Oliver, cannabis helps me so much for opiates or benzo withdrawal, but it's like a double-sided blade. It can definitely create anxiety and make it worse. Yes, like many medications out there. Remember, once we've modified cannabis far from its original form, this is almost like a potent pharmaceutical now. And you're right that like any pharmaceutical, there will be side effects the more we synthetically and artificially breed this plant. Pot does reverse for me. I smile and giggle, but I'm even more sad inside. Oh, Katie, I'm sorry to hear that, but I appreciate your vulnerability and sharing that. Everyone I know says it's not normal, but is it common experience? I have heard this experience from some of my patients. I don't know statistically how prevalent it is, but it's like the other paradoxes out there of caffeine, of benzodiazepines. We don't always know the true incidence in the population, the true prevalence, because there is so much individuality in our consciousness, which these medications and these medicinals, is natural or not, have some deep interplay with when we're talking about our mental health. Hey, thank you there, Straight Talk, no messing. Uh, so Mitzer Sport, I'm sorry to hear about this. THC gummies, these percentages are all over the place, especially if we consume too many of them. I hope that your IBD, your inflammatory bowel disease, has improved since. Uh, yes, I agree, Kite, about contributing to more research. I'm sure this will be done. Uh, Thank you. Thank you. A lot of flossing, a lot of brushing helps with that. Aspirin, Rachel Villagomez, aspirin was once thought to be the safe medication for everyone, but you all know what happens with aspirin, right? Let me know below. I'll give you a shout out. Why do we not recommend aspirin for everyone anymore? Please tell me, and I will give you that shout out. I think cannabis, like any drug, is not for anyone or everyone. Maybe you meant Scott. I'm with you. There's very few one size fits all out here, even though money interests will try to make it seem that way. And yes, Dave, I concur with you. It is so sad. Individuals, I'm going to tell you a story. When I was an undergraduate in Berkeley, some bozo went up on the stage. They told the whole auditorium of 1,000 kids that cannabis is perfectly safe. You cannot overdose on it. You have natural receptors in your body for it. Therefore, you cannot overdose. And people believed this person. I thought they were saying the truth until I learned later on, wait a minute, that makes no sense at all. There's a narrative out here about the safety of all sorts of either pharmaceuticals or non-pharmaceuticals. Thoughts even that we can entertain in our brains. These are not without side effect and risk. I can't believe someone told us that. What a dum-dum, right? Now I want to see who answered the question about aspirin. Hey, thank you for that super thanks there, Karen. Metformin good for insulin resistance. Well, metformin is often the first go-to prescription medication for insulin for pre-diabetics, where insulin resistance first begins. Of course, you want to speak with your doctor about that. But metformin is also being looked at as a life extension medication as well. Hey, thank you so much for the kind comments. Who here talked about, yes, aspirin. So aspirin is derived from the willow bark, like Melanie says, and the risk of bleeding in older adults was so high that the risk of benefit, the chance of benefit for the average adult is actually lower, meaning the risks are higher than the benefits. Why would you take it? We're learning about more and more number needed to treat versus number needed to harm for so many medications and supplements. Those are the numbers that you need to know about. We'll talk about them in a different video if you want. And ulcers, you're right that NSAIDs can cause ulcers. Aspirin is typically not associated with ulcers at a low dose, but it theoretically can, especially at the higher 325 milligram doses that some patients take. Very, very good. A lot of people got it right. Liver damage, not so much with aspirin, but many things can. Gastric problems, internal bleeding. You're right, it's a blood thinner. These are all the problems. Well, CBD helps with anxiety and Roy Quitter, and I'm happy to hear that. I hope that you use it responsibly. And smoking is bad. Vaping is probably not good either. Whether you're using it as a way to de-escalate from smoking is a different story, but please do not be fooled into thinking that vaping is harmless. Don't forget that you're superheating certain chemicals in that cartridge, vitamin E, cannabis. These are very, very toxic at such high temperatures that you're inhaling. So do please be very, very careful. It's only thing that will take my back pain away. Well, Debbie Hall, you're totally right that some individuals have tremendous pain relief with marijuana or cannabis, but not everyone. And there's so many differences in the strains, but I'm happy that it works for you. What's so crazy? Okay. Yes, about vaping. Dave, you're correct. Sorry, I'm looking away from the camera because I got to look at your comments. I'm not ignoring you, I promise. It's all about using medications wisely and listening to your body, says Karen Simon. Very good observation. Listening to your body. I think we'll end with this. We have a disconnection syndrome epidemic, at least in my patients. We are so disconnected from what our body is telling us. When we lose touch with ourselves, it's often when we've lost touch with others as well. And loneliness is inseparable from this. When we suffer from the disconnection syndrome from ourselves, our capacity for natural healing is greatly diminished. Can we reconnect with ourselves? Of course we can. When we've had past traumas, when we are stuck with depression, when we're addicted, when we have severe anxiety, it can be exceedingly difficult. You might cerebrally know everything that you need to know about your health, but you can't connect that viscerally with the rest of your body. And that is where a holistic treatment, an integrated medicine doctor can change your life. It's what I do with my patients with ketamine in a holistic way. But there's many ways of doing this. Altered states of consciousness can be very powerful to grease the wheels, if you will, to facilitate this profound growth and transformation, to reconnect with the self so we can reconnect with our innate healing capacity. I know it sounds like a bunch of mumbo jumbo when someone is in a deep, dark place. And I'm not making light of the dark depths, the crevasses that they're stuck in. They can be so serious, and I've seen so many patients stuck with that. But please don't lose hope. Hope with the right guidance, with a doctor who's trained, with a professional, not just, hope founded on a Reddit subpost, but hope from an authentic healer who is experienced and trained can make all the difference. Someone said placebo is the only miracle in medicine. Well, some placebos have side effects, but I'm with you on that overall in the ethos. But hope can be a doorway to reopening a path to reconnection with the innate healing capacity. Please don't lose hope that it is possible there for you. I'm not saying it's easy. I'm not making light of your hardships or suffering. But if we give in to doubt and fear, it will always erode our self-confidence and our confidence in finding that healing. So if you learn something new, please share what you've learned with others so you can help others advocate in our, unfortunately, terribly broken healthcare setting. Remember that you have more power over your health than you've ever been told. Until next time.